NUBEQA darolutamide is a prescription medicine used to treat adults with prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone. Watch the full video for more important safety information.
I'm from an era where there were a lot of muscle cars.
I consider myself to be a gearhead and am very passionate about cars, from owning different vintage sports cars and taking adventures in them with my wife to making models of classic cars. I make models of cars that I've owned in the past, and I make models of cars that friends of mine own today.
When I was getting out of the service, we had a little convertible sports car, and the picture was the day that we actually finished working on the sports car to get it ready for the trip back to Indiana. It was in the auto hobby shop at the base that I was stationed at, and the two of us were sitting in it getting ready to pull out. That was almost 50 years ago. My name is Dick. I'm 73 years old. This is my wife, Jan. We've been married for almost 50 years now. We have 3 children. We have 9 grandchildren. We're originally from Indiana, but we've lived in Iowa most of our adult life. 11 years ago, I was diagnosed with prostate cancer. Currently, I have non-metastatic castration-resistant prostate cancer, which means it has not progressed outside of my prostate area, but it's castration-resistant because it's no longer responding to hormone therapy, which means my PSA is rising, and it indicates that the cancer is progressing. I've been living with this for about 3 years now. My first reaction when I was told that I had prostate cancer was, let's have surgery today and get this out of my body. So I did undergo a prostatectomy. During the prostatectomy, there was additional tissue that they had to remove. And after the surgery was over, I had to immediately begin hormone therapy. I remember that when I got home from my surgery, I was very emotional. I had a very difficult time sitting down with my family to talk about this issue. They were very understanding, very accepting, and very supportive of the situation that we were facing. As my cancer progressed and it began not reacting to the hormone therapy that I was on, my PSA began to rise. And as my PSA was rising, I would go in and see my oncologist on a regular basis, and we would track the rise in the PSA. Finally, it got to a point where he suggested that we consider changing to a different kind of treatment. My oncologist suggested NUBEQA as an appropriate treatment for me, and it certainly has been. I had actually done some research into NUBEQA when he had suggested that as an option. I had gone out and read the phase 3 study, and I was especially impressed by the fact that it had delayed the progression of prostate cancer on average 3.5 years for the patients that were taking NUBEQA. And to me, 3.5 years meant a lot at that particular point in time. For the last 3 years, my PSA has been undetectable. So it has been a very successful drug and treatment for me. When my oncologist introduced me to NUBEQA, of course, there are side effects, and he went through some of the more significant ones. There could be high blood pressure. There were various side effects. I decided that it was worth a try and see how I got along with it. And fortunately, I did not experience any of the side effects that had been discussed with me.
10 years ago, when he was first diagnosed, I really didn't think we'd be here today together. So I'm very thankful.
Jan is my caregiver and my advocate through all of this.
I've been on this journey with him, and I wouldn't want to be anyplace else.
We are always together, wherever life takes us, and my prostate cancer diagnosis has just been one piece of our puzzle. Now I feel like we have time to get back to doing the things that we love, like cruising around in classic cars together. We're fortunate to have memories together in our old convertible sports car, and even more fortunate that I'm able to manage my prostate cancer so we can still have this time together for more adventures in the convertible we have today. These cars have special memories tied to them, and getting to recreate one of our favorite pictures from the first big road trip in 1973 is a memory that will live forever. We're always looking for our next adventure and love to ride around in this car, especially in the summertime with the top down. Occasionally, we like to jump in the convertible and travel around the state and seek out different ice cream shops.
Our kids will text us and say, "Where are you?" And we'll say, "We're in Mason City." And they'll say, "What are you doing there?" "We found an ice cream place up here." And we've done that kind of all over the state, haven't we?
We have.
My love of cars extends beyond just driving them.
I spend most of my time making model cars. I make a lot of vintage cars that are from the 60s and 70s and have a lot of fun doing that.
Early in my diagnosis, I had a lot of depression. I kind of lost interest in a lot of things that I was doing. So there was a period of about 3 or 4 years where I didn't really do any modeling or working on classic cars.
Even with the kids, he would sit and not really have interest in things. He would be there, but he was detached. You know, he wasn't present really.
Fortunately, I was able to overcome the depression and have an interest in modeling again. Since then, I have started NUBEQA, and now I have the time to continue building models.
He's back, and he's back modeling with lots of cars.
I think one of the most important things that you have to do when you're experiencing a disease such as cancer is you have to talk to your doctor about what you're feeling in your body. And they will obviously do a lot of tests to try to determine the stage and the status of the cancer that they're working with. But it's very important to listen to your doctor, be able to communicate with your doctor so that you both have a good understanding of what you're going through and what are the available medications and treatments, and understanding the side effects that you might encounter in these various treatments as you make decisions about the treatment options that are available to you. And there's nothing wrong with getting second opinions. You need to be comfortable with where you're at and what you're being told in terms of medications and treatments. Intimacy is probably one of the big issues that has changed in my life, which affects us as a couple. I have to really think about giving Jan a hug and a kiss each day.
I accept every hug I get.
It's very helpful to have your entire family behind you during this journey. Our grandchildren are ages 2 through 16. Obviously, we have some in junior high and high school that are starting to participate in sports and other school activities. We often have to choose who we're going to see because there are multiple events on the same day. But we've managed to get around and watch all of them participate in their activities. And it's truly a joy for us.
We have a basketball court, and they had drawn with chalk all over our basketball court and left us little messages and stuff.
They drew hearts, said we love you, and it was a very touching experience. I'm not able to do a lot of physical things that I was able to do before, but over time I have learned to accept the things that I can't change and to work on the things that I can improve.
We appreciate more just a normal life, even our new normal. You don't take little things for granted. You actually even stop and think about it and say, wow, I'm so happy we got to do this today.
It's a long journey. It's more of a marathon, I guess they would say, than a sprint.
Important safety information. Before taking NUBEQA, tell your healthcare provider about all your medical conditions, including if you have heart problems, high blood pressure, diabetes, or high amounts of fat or cholesterol in your blood, dyslipidemia, have a history of seizures, brain injury, stroke, or brain tumors, have kidney or liver problems, are pregnant or plan to become pregnant. NUBEQA can cause harm to your unborn baby and loss of pregnancy, miscarriage, have a partner who may become pregnant. Males who have female partners who may become pregnant should use effective birth control, contraception, during treatment and for 1 week after the last dose of NUBEQA. Talk with your healthcare provider about birth control methods. Are breastfeeding or plan to breastfeed? It is not known if NUBEQA passes into breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. NUBEQA may affect the way other medicines work, and other medicines may affect how NUBEQA works. You should not start or stop any medicine before you talk with the healthcare provider that prescribed NUBEQA. Know the medicines you take. Keep a list of them with you to show to your healthcare provider and pharmacist when you get a new medicine. NUBEQA may cause serious side effects, including heart disease. Blockage of the arteries in the heart, ischemic heart disease, that can lead to death has happened in some people during treatment with NUBEQA. Your healthcare provider will monitor you for signs and symptoms of heart problems during your treatment with NUBEQA. Call your healthcare provider or get medical help right away if you get chest pain or discomfort at rest or with activity or shortness of breath during your treatment with NUBEQA. Seizure. Treatment with NUBEQA may increase your risk of having a seizure. You should avoid activities where a sudden loss of consciousness could cause serious harm to yourself or others. Tell your healthcare provider right away if you have loss of consciousness or seizure during treatment with NUBEQA. The most common side effects of NUBEQA include increase in liver function tests, decreased white blood cells, neutropenia, feeling more tired than usual. NUBEQA may cause fertility problems in males, which may affect the ability to father children. Talk to your healthcare provider if you have concerns about fertility. These are not all the possible side effects of NUBEQA. Call your healthcare provider for medical advice about side effects. You are encouraged to report side effects or quality complaints of products to the FDA by visiting www.fda.gov/medwatch or calling 1-800-FDA-1088. Please see full prescribing information at www.nubeqa.com/PI.